Hello. How are you? How are you? So much I wish I knew sooner. I love that. That's a great handle. Hi, my lotus flower. How are we doing? Everybody good tonight? I'm going to be quite frank. I'm exhausted. I got 3 hours and 27 minutes of sleep last night. Hey, y'all. Hey, friends. Hi, I know it's been a minute. We're back. I'm super excited because National Menopause Awareness Month. I went to an amazing event on Sunday, Power in the Pause, put on by the Black Women's Health Imperative. So good. So good. So good. I don't know why I haven't gotten any sleep, friend. I was up at 3 o'clock, looking at the walls. 3:30. What is happening here? I am spent. Because I get my sleep. Look, y'all, I get 7 hours, so I do it. Right? At minimum, I'm at 7 hours. I don't play around. I try to go to bed at 9:30. I didn't last night, but I try to be in bed at 9:30. But anyway, I hope everybody's doing well. I will get sleep tonight. Yes, I will. I hope everybody's doing very well. Tell me what's been going on with you. I want to know. I know right now I'm super excited about Dr. Ayanna. I can't even tell you. Okay. Wait. Let's see. Let me invite her. Dr. Ayanna. Let's get her. She's here. Yes.
Hello.
Hello. Y'all.
Sorry about that.
Oh, no. Listen, my husband always says nobody died. Why are we getting, why are we excited, upset, or whatever? You know what I'm saying? That's his,
He is correct.
right?
He is correct.
Okay, we can wait, right? It's all right.
He is correct. There
Well,
we
how
go.
are you
There we
today?
go. I am all right. How are you?
I was just telling everybody that I am exhausted. That I
You are
only,
exhausted. Yeah.
okay, I got
About,
3 hours and
that's about
27
it.
minutes of sleep. I
Painful. That
appreciate your
hurts.
empathy, and I
That's hurts.
appreciate that empathy.
That
Yeah,
hurts. That's real.
because I'm a 7 hour
That's real.
girl. I'm
Yeah.
7 hours.
I'm not even gonna go into the assessment that I have the urge to do, but I'ma just
Well, we're gonna have plenty of that. We are going to have plenty of
Yes.
that because I have to tell you,
Yes.
seeing you and meeting you on Sunday was literally mind blowing for me. And the prayer
Oh.
answered because I you know, when you're doing something like this, you want to be careful about who you present to the world, to people, right?
Yep.
I'll be
Yep.
honest with you, and I mean, I'm all about the credentials. I like letters. As you can see, wait, I like letters, and my husband carries a few, and y'all don't like to really put the letters out there, but I like it, right? Because it means you did something, you studied something.
I studied something. I studied
Yeah,
for a real long time.
yes. So I
Woo.
do understand that, and I really kind of want to get in because I want everybody to understand who we're playing with, right? Who's sitting in front of us. You know what you've done, but everybody else does not. So,
Let's
guys,
do it.
I want to introduce you to Dr. Ayanna Abrams. She is a licensed clinical psychologist, capital P, lowercase s, lowercase y. Is it a period, dot, whatever, and the D?
Period dot D period. I can explain that if you want me to explain that, but yes,
No, my
yes.
husband explained it to me. Thank you very much. So I do understand what it means. You are a doctor of psychology. Let's be
Yes.
clear. This is Dr. Ayanna
Yes,
Abrams. Thank you
yes,
very
yes.
much. All right. So
Mm-hmm.
so there's that. She's the founder of Ascension Behavioral Health, co-founder of Not So Strong, which is an initiative to improve the mental health and relationships functioning Black women.
Mhm.
Her specialties, which I think is very powerful, include racism-based trauma, mood disorders treatment, burnout prevention, burnout prevention, burnout prevention, and helping people create and recreate healthy romantic friendship, career, and familiar relationships. She has extensive clinical and research background and experience working with Black people across the diaspora, and has been featured as a speaker or contributing writer in New York Times, The Atlantic, Essence, Therapy for Black Girls, Silence the Shame. I mean, the list goes on and on. She is also contributing author to the books Emotionally Focused Therapy for African American Couples, Love Heals, and the Handbook on Counseling African American Women. I mean, psychological symptoms, treatments, case studies. She currently sits on the board of Black Girls Smile and the Silence the Shame nonprofit organizations. So there we have it. She's a rock star. All right. That's
I'm
what we're doing
busy.
today.
I'm busy. I'm also tired. I'm tired.
See,
I'm tired.
okay.
That's a
Well,
lot.
I
That's a
would
lot.
be tired too if this is what it looked like, right? So I just want to dive in. Yeah.
Yeah, yeah. We can start anywhere and we can go where we
Thank
need to go.
you, guys. So we're just going to get into it, and my what is good mental health? What is
Mm,
it?
hmm That's a good question. That's a good question. So the way that I like beginning to talk about mental health is for us to view mental health on a spectrum,
Okay.
right? So there's mental health, and there can be like poor mental health or kind of inadequate mental health, right? So kind of on a spectrum from wellness to not being well, right, for whatever reason. And everybody's on the spectrum, right? And
Okay.
anything can take us up the spectrum, kind of upstream towards having a better mental health, and anything can take us downstream, right?
Okay.
Any one of us can go upstream or downstream, right? And the reason I'm naming that is that oftentimes there's an othering that can happen when we talk about mental health. So there are people who are seen as having good mental health and like bad mental health. And that's why I want us to really talk about this on a spectrum of anything could happen and you're moved upstream or downstream, whether it's something that's within your control or not within your control, right? Everyone's on the same spectrum, right,
Okay.
of health. So we're going to talk about it as we'll go with good mental health, right? So essentially when we think and talk about mental health, we are talking about decision making, we are talking about emotional functioning, and we are talking about interpersonal effectiveness, right? Our ability to kind of communicate and kind of be in relationship, safe and healthy relationships with others, right? All of that encompasses your mental health, how you think, how you feel, and what you do. Somebody who has good or kind of is in better mental health is making appropriate decisions for themselves, is able to manage their emotions effectively to get their needs met in the world, to be able to kind of operate as, and this is very, very respective, right? A contributor to society, right, and kind of cultural norms in any way,
Mm-hmm.
and is able to kind of make decisions that help them adaptively, right, live in this world, right? So taking care of themselves, right? And in various ways, whatever that might mean, right? So you are more likely to have better, quote unquote, mental health if those things feel a bit more in your control. I'm able to access safe and healthy relationships and somebody can't hear me?
You can't hear? I can hear you.
Okay, you can hear
I
me. Okay,
can hear you loud and clear. You guys, can you
okay.
hear? Can you hear?
That makes me nervous. Can other people hear?
Can you guys hear? Oh, Rolanda says she can't hear. Oh, okay. So
Okay, someone else said they can hear
yeah.
though. Okay. All I need is one. Okay, so if you are able to access healthy relationships and be healthy in relationships with others, again, if you are paying attention to how you're able to make decisions and kind of in terms of like reactivity or kind of reflection on things and kind of learning things as you go along, we might say that you are exhibiting, right, quote unquote, good, right, or better mental health than somebody who really struggles in those areas, right? So persistent struggles in the area of relationships, persistent struggles with decision making that supports your health and well-being, right? Persistent struggles with other ways in which you take care of yourself, right? Keeping on top of your hygiene, right? Keeping on top of other things that are important to you. We would look at all of those different factors to really determine where you are on the spectrum of mental health. But there are a lot more factors: sleep, nutrition, like all these kinds of things. There are so many factors that a therapist would pay attention to and kind of get curious about to be able to fully assess where you are on that spectrum.
Wow. So it's just, I mean, it's fluid.
Hmm. It is fluid.
It's
It
fluid,
is
but there's a
fluid.
baseline.
Yes.
You're saying there's a
And
baseline, and that baseline is always
everybody
social
has
norms.
their unique, right. And everybody has their unique baseline, right?
That makes
So
sense.
mental
Hmm.
health is also very unique to each person, right? And so the way that I talk about it on the spectrum is like, while there is this kind of wide spectrum that we tend to look at from like a medical model, right? And kind of from a health perspective, everybody's in their own unique place, right? Decisions that are good for you aren't decisions that are good for me. Us
Right.
making the same decision, right, will have a different impact on our lives, and then that could determine how well we are in whatever instance, right? And the reason that I also talk about mental health on a spectrum is to also decrease the stigma and to decrease this ability or kind of capacity that society has to other people. So what I oftentimes talk to clients about, and different people or kind of organizations or companies about, is at any given point, right, in a matter of 3 seconds, right, your mental health can change. You can receive a phone call
Okay.
that changes your life,
Oh yeah,
right?
know it.
Right? You can receive a phone call. There can be an accident. There can be news that you hear, whatever it is, right? And your mental health is drastically changed from that point on. So I don't, I want people to be mindful of othering people, right, who they perceive as not being in good health, right? Because you might not be far from that. You could lose your job and things will be vastly different from you. You could be thrown into a depressive episode, right? So being mindful of judging people who are struggling with their circumstances, because your circumstance can change in seconds.
That is so powerful. I mean, that's just the net of it, right?
Mhm.
Because you put your toe
It's
out the
real.
door, you put your toe out the door, and you're driving your car down the road. You're at the mercy of everything happening around you,
Yeah.
right?
You can be in your house minding your business and a global pandemic begins,
Oh,
right? Anything
right.
can happen, right? So let's show respect to people in their unique struggles.
Or maybe, let's see, you wake up one day and you wonder why you don't feel well. And those days turn into weeks, and those weeks turn into months, and those months turn into years. And people are telling you, nope, it's all in your head. No, no,
Yeah.
no, 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 no. And then,
And then,
and then the wheels
right?
fall off the bus. So I'm just going to literally like plow right into that, right?
Yes, let's
So
go.
I think pretty much overall, anybody who's in my age demographic, so I'm 52, I'll be 53 in
Mhm.
December.
Mhm.
We all have similar experiences as it relates to perimenopause and menopause,
Mhm.
because quite frankly, nobody was talking about it, right? Our mothers definitely. I mean, you're not having that conversation because they didn't know what was
Mhm.
happening to them, right?
Mhm.
I asked my
Mhm.
mom, and she said, "Well, I went to the library and got a book."
Mhm.
So I was like,
That's how she learned.
about what?" She said, "I
Mhm.
found one book in
One.
the library, one, and of course it didn't say perimenopause; it was menopause." And
Right.
she, I remember her saying, "Sometimes I still have hot flashes." I said, "At 75,
Wow.
right?" So
Mhm.
how?
And she maybe found that one book after however long of not knowing what was going on with her. And then it's like, let me go figure something else out.
And then, and let me say this: she worked in corporate America,
Mhm.
so at a time when Black women, I mean, we barely have a voice now in those environments where you didn't have a voice. You collected your check and experienced, microaggression until experience, sexual harassment, racial,
Mhm.
all the things, right? So while that's happening too.
Mhm.
The night sweats, the anxiety, the depression, the weight gain, the dry hoo ha, all the things are happening,
Yeah.
and nobody has answers for you,
Nobody has answers.
right?
No.
So how? I mean, I mean, guys, everybody on, we all. I mean, it was a nightmare. I like literally,
Mhm.
and it did. Now that I know what I know, it didn't have to be, right? But
Mhm.
how
Mhm.
do we like? How, I'm still trying. I live in it. Like
Yeah.
though I feel 100% better, I almost can't help going back to it, like saying, I remember
Mhm.
when this happened. It was horrible.
Mhm.
I'm always
Mhm.
like raising my hand to tell the story. How
Yeah.
do we depart from that, and we now feel better, right? I
Mhm.
almost resent the
Mhm.
perimenopause, the menopause. I
Yeah.
resent it,
Yeah.
right? I was in the best shape of my life, and I'm not now. And
Mhm.
I'm trying. It is a constant battle, and I don't understand it. I resent it.
When I'm listening to your language, and this is something that I talk about with clients oftentimes, right? What you are talking about is loss.
Ooh,
Right? And oftentimes we don't talk about this as an experience of loss. We don't talk about this as grief.
loss.
That is
Ooh,
what you are naming. That's why you
y'all.
keep talking about it. I lost parts of self. I lost parts of my functioning. It's really difficult for me to reconcile that. And you might not ever be able to depart from it, right? But what we're looking at is how do I integrate that into this experience that I had? And I experienced loss at a much more intense level because I didn't have information and knowledge about what was happening to me.
Y'all, did you hear
And
that?
not having information, not having knowledge, not having support around it can translate as trauma to the body. This is not me projecting trauma onto you, but this can be a traumatic experience for people when they do not have knowledge, insight, resources, or support around this. And you are left alone with a significant sense of loss. That's what you're talking about. I went through that and I didn't know what was happening and everything was changing and I was losing things that I was used to. I was losing aspects of my functioning and I did not know what was going on with me. But I knew that things were different and I couldn't do things the same. I didn't feel the same. I didn't have access to the same way in which I was thinking and kind of moving about my day. I didn't have the same maybe freedoms that I did because now I had to pay attention to sweating and what I'm wearing and where I'm going and how long I'm gonna be away from home. Like all these other things that now, right, that we have to incorporate as this additional labor. I have to now think about things in a different way, right? So I increased labor and I lost a lot of ways in which I knew myself. So there's an identity piece there as well. And we don't talk about this as loss. And it doesn't have to be this kind of degree of loss, right? But there are aspects of this transition that can really, really feel like a loss. And we just don't use language around grief the way in which I think could be helpful and more appropriate.
Wow. Like that's so I'm sitting here thinking, like as you're like I'm processing the words,
Mm-hmm.
right? Like, oh gosh, because that's I do feel like I lost something, right?
Mm-hmm.
And and not by choice. Like, so I'm
Mm-hmm.
big on, okay, is that control or is it choice? I don't know what I'm trying to do, but right? Okay.
You're big on autonomy.
Okay,
You're big on
I
autonomy.
love that. Yes. And I don't like the fact, I think why I'm so passionate about this perimenopause, menopause wellness thing is because who wants to lose autonomy over their body? Like, what?
Yeah.
No. Like,
No one wants to lose that.
we tell our kids, we talk to our girls about their period. My mother in the 70s be a book
Mm-hmm.
at 5 years old because she
Wow.
was so scared.
Mm-hmm.
She was so scared. She never wanted me to be in a situation where somebody touched me the wrong way,
Mm-hmm.
interacted with me the wrong way. So I knew what my body parts were. So she sat down at 5. And I don't remember the conversation, but I remember the feeling of
Mm-hmm.
us talking about this, right? And really she drilled it in. Like,
Yep.
it's your body. Nobody, here's
Mm-hmm.
your box. They
Bodily
don't come into this box.
autonomy.
Yes. So,
Bodily autonomy,
oh my
right?
goodness. Oh my goodness. Now,
There
am
it
I having
goes.
therapy on the phone with this woman? I feel like I need to send you a check. I might
That's
need to
how
send you
people
a check
feel.
because look, wait,
Bodily
wait,
autonomy, right?
wait.
And ways in which we access autonomy through information about ourselves, through insight, through awareness, through community, through being able to talk to my mother about these things. That increases your sense of autonomy. She wanted you to have autonomy. You needed knowledge in order to have
And I
autonomy.
didn't have that with this,
Yeah.
right? And
It's interesting, right? Because she understood it for that transition. She didn't understand it for this transition.
and that's my point, right?
Mm-hmm.
Anybody who's in the sound of our voices, like this is something just as much as you, like Lisa with the documentary, the period
Yes.
documentary, all
Yes.
right? We're having these conversations with the young girls about
Mm-hmm.
their bodies. We need to finish the conversation so they can stay ready, so they don't have to get ready. All
Yes.
right. So we belabored that, guys. I feel like we all
Mm-hmm.
need to kind of look within and kind of say, wait a minute, is this loss? Because the loss of a period, now that part I was like ecstatic about. I was like, this is the best thing ever. Like, are you kidding me? right? But all the other things that come
All
with
the
it.
other
All
things
right.
that come with that.
So that's
Yes, right. So
how you're.
there's a way in which where there can be some relief at loss of the managing, right, of the demand, right, of a period, right, in terms of how that what that means for our external lives. But there's also loss in terms of what periods serve to do, and the estrogen loss and all those kinds of things. Like, yeah, there's that kind of thing that I get release from.
Right.
I lose the labor of having to manage this, and being in a society that's still, where this is still very taboo, where we are taxed on this, right, where a lot of people still don't understand it. There's still a lot of stigma. We lose the labor of that, but we also lose, right, other parts of our biological functioning with that as well.
All right. So I want us to, right, we're going to have the pocket, the word grief. We're going to keep
Yep.
that because I want to
Okay.
hit that because,
Catch it.
okay.
Mm-hmm.
Thank you. So you speak to that. You just said with body autonomy. So as adults at this age, going through perimenopause, right, there's the intimacy conversation, right? So how, like, having that conversation, look, I don't want you to touch it, me, don't look at me, right? It doesn't feel right. Even you touching me doesn't feel right.
Yeah.
Full stop, right? Right? Because the dry
Yep.
vagina, right? The itchy skin, things of that nature, right? And honestly, men don't necessarily, because they don't get there's no book for them, like they're not learning about this either, which is unfortunate because
They're
they
not
have the,
socialized
they're
to
not
learn it. Yep.
social. That's okay, very good. It's not socialized to learn it, which is odd because the same thing happens to them with andropause. So it's really weird that we're not. And I just want to be clear what I just said. Men go through, doctor, tell me if I'm right or wrong, the exact same thing,
Yep.
and it's called andropause, and literally the same things happen. It's the loss of
Loss of
testosterone,
testosterone,
okay, but
progesterone, right? The same hormones,
the
right?
same
They
hormones,
experience a
but that's
decrease
called,
in them.
and maybe they don't acknowledge it, but the loss in libido also,
Mm-hmm.
right?
Mm-hmm. Well,
But
they acknowledge it. There's a whole pill. They acknowledge
oh,
it.
look at you. This is
They
why you're the
are
doctor.
so they're socialized. We're like, hey, we don't have to acknowledge it for too long. We made a pill for y'all real quick.
See
They acknowledge it, and they took care of it real quickly.
that they continue to study like it's nobody's business. All right. Which is called the midlife crisis versus andropause, which what it is the exact same thing we're going through. And we're made to look as though we are what you can use the clinical word. I will not use the words I want to use. But I'm just saying, like, something is just not right.
Yeah, yeah. It's
Right.
stigma. It's
So how do
stigma.
we
It's
but
gendered. It's misogyny. Yeah. Good.
how do we come to you? How, like,
Mm-hmm.
how all the thing, like, the intimacy decreases, there's no ifs, ands, or buts about it. There's a period of time with that transition where it's just like, oh, no, no. And sometimes you can't even articulate it because you don't even know what's happening, right?
And
Which can damage
with
relationships,
them.
right?
Yeah.
There could be a fracture, a break, a fracture, a sprain, whatever
Mm-hmm.
you want to call it. So how are we dealing with that?
Yeah. So I want to highlight a few things, right? That there is a reason that that damage and that fracture and that strain happens, right? So one, we've got these gender differences in information, in knowledge, in access, in care, in concern, right? So it already, because there's already stigma, right? Even from when we are entering, right, phases of menstruation, menses, there's already stigma
Right.
there, right? So stigma exists across this whole spectrum of development for half the world, right? That's already there, right? So even as we are noticing different things happening, we're less likely to talk, but if we have male partners, cisgender male partners, right? We're less likely to talk to them about what is happening because there's still the stigma that we should still be functioning in a certain way because we're concerned about loss of them. Right. So we're thinking about socializing and how we've been socialized, that if I don't function in this way, again, sexually, intimately, right? These are the things that we're also socialized and convinced, right? That this is what men want from us and this is what men need in relationships and this is the high demand for this. If I'm not interested in this anymore, I risk losing him because he was also socialized the same way, right? So that becomes one barrier to not talking about it. All right. I don't want to show up in a way in which I can't offer this or I'm not interested in this, right? We all already might be in a dynamic where that has plummeted for any other reasons, stress, parenting, medical issues, like all this other stuff that might be happening that might already have that on some type of ice. So there's already a barrier in terms of lack of information, um, lack of community around it to be able to access information, gendered norms around it, right? Where this is uncomfortable to talk about. And if maybe I do try to talk about it, they get all squeamish and they don't want to hear about it, right? So all of that factors in.
Okay.
Then there's this other piece about when something is happening and I'm noticing that I'm having this response to intimacy. I'm noticing that literally I feel uncomfortable in my skin. I feel uncomfortable with clothing on me. Like I just feel uncomfortable, right? I also want to have the language to be able to explain it to you exactly what's happening. And what if I don't know? And if I don't know what's happening, I'm less likely to share it with you. But that's actually where I want to offer some bit of a challenge to be able to share. I don't know what's happening, but this is what I'm feeling and thinking. These are the thoughts that come up for me. I don't know exactly what is happening, but like just touch is really like itchy and uncomfortable for me. I don't exactly know what is happening, and I've been thinking about it. I've been researching it. I'm going to go see a doctor about it. I'm scared to really figure this out because I'm worried about what's happening, but something is making it really difficult for me to even consider intimacy. And I'm worried about this. There's a vulnerability that comes with that. Vulnerability of not having to know what is going on, but being able to speak to what you do know. This feels really uncomfortable for me. I don't know why. I just started noticing this. I haven't been able to make sense of it, but I want to communicate it to you because it's something that's going on with me. That takes a lot of vulnerability.
That takes a lot of vulnerability. Absolutely.
To say you don't know what's happening. But again, what I do know is that touch feels uncomfortable. And I think it's having an effect on my interest or desire to be physically intimate with you. And I'd like to talk about that. But if we don't have a safe enough connection to talk about that, then we've got some other issues in the relationship.
Oh, I was just literally about to say, okay, well, there's another level to this. Like, you got to be willing to have the conversation, which sometimes can be uncomfortable for people, right? I mean, extremely uncomfortable because, again, it's almost like people projecting, right? Like you're saying something's wrong with me. Like, no, I'm not saying anything's wrong with you. I'm talking about me,
wrong with you.
right? I'm speaking about what's happening to me. And I could envision for some people that could be quite complicated, right?
Absolutely. Absolutely. And are we willing to navigate the complications of this? This is complex. Our lives being intertwined in these ways is complex. What do we do when the complex happens? The complex is happening, right? Happen. How do we create the dynamic where we're going to be talking about the hard things? If you already are in a practice of talking about hard things, this can be one of those, right? But that really also depends on what kind of relationship you're in.
It depends on what kind of relationship that you are in. Wow. Because there's layers. There are layers, right? There just absolutely are layers. And you know, like I think about my husband and I, we're 12 years apart in age. So we're experiencing very different things. We've experienced very different things at different times.
At different times,
and I think that it might have worked in our favor, kind of in a very weird way, right? But you know, we're overly communicative, so that's it. And as it relates to things that will impact both of us, does that make sense? Right? And that's just being transparent. Like maybe not things that don't, but things that we know that are going to impact us, right? So,
but I think that this begs this reflection of, right, for people to think about in my relationship with this person, right, however long it's been. Do we talk about our bodies? Do we talk about medical things that are happening? Do we talk about our doctor's appointments? Do we talk about changes? Do we only talk about when my knee hurts or when my back hurts? Do we talk about our periods? Do we talk about, you know, what's going on with libido? Is this a relationship where we're even talking about those things, right? Because again, if we're not, this conversation is going to be much harder to kind of interject in there versus already setting some standards around what we talk about with each other. And what do we understand about not talking about those things with each other? What are we trying to protect ourselves from? What are the norms that we're bringing in that says men can't hear about these things, right? We're seeing some shifts, right, generationally, where more people who have periods are talking more openly about it. They're not hiding their tampons as much. They're kind of doing all these things, right, to kind of make this a much more open conversation, right? But that's not how a lot of the world lives, that's still a very, very new shift. Very, 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 very new shift, right? But it really does at least create an opportunity to reflect on what are we not talking about and why? And what does that mean to me? And if I want to change that, how do I offer that in? Hey, I'd like to start talking about things that are happening with our bodies as we're aging or as we're developing. Can we start doing that?
And I think the language you use is just is so clear, right?
Mm-hmm.
It's just clear, right? It's not a lot
It's
of
direct.
words. It's not a lot of words. It's just very clear and concise. And trust me, this replay, I'm gonna put the captions on so I can like that and do better with that communication, or sit on your couch.
Yeah. It takes skills and practice, right? And I've been right that there's a way, right? This is not how we are socialized. It's not language that we have. So it takes taking the risk to talk about things we haven't talked about. And there's a way in which you can also frame that. I know we don't tend to talk about stuff with our body. So this feels really awkward. Like I've been thinking for a few weeks about bringing this up to you, right? Tell the truth. Like make it transparent that this is not something that we do. This is something that feels even awkward for me, and I can picture it feeling really awkward for you, but it is something that I think is important to talk about.
Yeah, I definitely do. And I like, again, and I'm sure a lot of people, I'm not the only person that experiences. I mean, my husband and I were forced into talking about medical things because he had a heart transplant almost 7 years ago. So I'm
Mm-hmm.
on every doctor's appointment even to this day, and he's
Here we are.
fine, right? But I'm
Yeah.
in there
Yep.
like he's like, here's the access to all my medical like I go through, like, so there's not a lot of like gray area, and then I
Yeah.
realized I was like, well, he's a grown man. Like he's allowed to.
Mm-hmm.
I'm not his mother, right? When he
Yep.
needed me, right, it was appropriate. When he needed an advocate in the room to
Yep.
ensure that everything was going the way it needs to go.
Mm-hmm.
But now, like, why? What am I doing on doctor's appointments, right?
Yep. Right. When he needed me in this way, that was me showing up in partnership. He needed his partner to be there as an advocate for him,
Right.
right? He's not needing those same things for kind of regular doctor's appointments, right? So that could be a conversation like, hey, I actually don't need this. Or do you want me? Like, do you actually want me to have this information?
Right, which he does in the reverse, right? Because I'm like, you're not coming to doctor's appointments. That's ridiculous. Because what's the point? You're not going to ask the same questions I'm going to ask. You're not going to insert yourself. Like, I mean, I don't understand what the point is. He's like, I don't think that's why. I just think because you want to own it. It's yours, right? So anyway, right. But I think that the communication piece is extremely important, right? And again,
Absolutely.
people have to own. Like you said something very important on Sunday, and I think you know what I'm talking about. And you made the comment that
Oh,
the you own what you said. You own. Everybody's responsible for their own pleasure. Whoa.
mm-hmm. I heard the room go.
There was a hush. There was a
Oh,
like like whoa. What is she
yeah.
talking about?
Mm-hmm.
And
Mm-hmm. That's
interestingly
also
enough,
that's another part of the spectrum of the bodily autonomy. I am responsible for my
so tell
pleasure,
me what that
self,
means.
and being able to access
What does
resources.
that mean?
Mm-hmm.
Go. Yep.
And the reason I say it also like that is because it's also usually kind of very gendered, right, conversation. But when we think about the ways in which we've learned about sex and sexuality, it firmly places other people responsible for my pleasure, right? So if I am not having the sexual experience I want to have, I blame it on you. You didn't do this well. You didn't do this well. You didn't stroke this way. You didn't back it up this way. You didn't move this way. You didn't do all these different things versus what does it mean to use your voice and say, this is what I like. This is what I don't like. Do this differently in this way. Let's incorporate this, kind of toy, or let's bring in different things that could actually help me experience this differently. No, that hurts. I don't want to do that anymore. I used to like that. I don't like that anymore, right? That's about your autonomy. That's you being responsible for your pleasure and not putting it all on your partner, right? To supply all of that. They are a supplement to your pleasure, but they are not
Whoa.
solely responsible for your pleasure because you can also pleasure yourself on your own if you get to know your body.
How about that? So
How about
there's
that?
some ownership there.
There's some ownership there, which is an opportunity for ownership, right? So ideally, what that gives people is some kind of agency, right, in their pleasure versus feeling completely dependent on someone else to access pleasure. That's ideally
God,
what it offers, right, is agency.
agency. And I don't think we're
Mm-hmm.
all used to having agency.
No, not at all. Especially not Black women, right? And for many reasons, right? When we look, socio-political, historically, right? We have not been agents of our own bodies. We were owned. We were enslaved, right? We were told when we were having sex, right? Sex was taken from us, right? All these things happened where bodily autonomy was not a thing for us, right? And then we also that passed down through generation where it's still something that's very new for people. I work with couples, right, where and this is typically, cis hetero
Mhm.
couples where when they talk about sex and sexuality, regardless of what's going on with their bodies, regardless of age, regardless of medical concerns, there's oftentimes a sense of ownership, right, over her body. You are supposed to have sex with me as the male. You're supposed to have sex with me. You're my wife. That's one of your responsibilities is sex. That is still in the ether. That
Yeah,
is a responsibility of yours to have sex with me. And many people believe that I owe you sex because we're married or because we're in a relationship or because we're monogamous or because we've been dating for a year, whatever the right, there's always some underlying kind of rule around it, but that I owe you sex because of the relationship that we're in. That is not bodily
that is
autonomy.
not bodily autonomy.
That is not bodily autonomy, right? But that is a cultural norm, right? That you should give me this thing because I am in this type of relationship with you. So it makes it really difficult to access boundaries, right? Even more difficult for Black women to access those kinds of boundaries because we spent so much, particularly um, on this side of the world, spent so much of our lives historically, right, and ancestrally not being in control of our bodies. So we do what we know is that, oh, yeah, my body has now been turned over to you. When we look at the Institute of Marriage, that was about
Right.
possession and ownership. Your father owned you, right? And now your husband owns you, right? Your body was never yours. These are things that factor into not understanding our bodies, not getting information about our bodies, medical providers not thinking that it's important to give us information, education on our bodies.
So I'm just going to shift a tiny bit. So I made the comment that about being empowered with information, right?
Mm-hmm.
So that you can make an informed decision about your body. And somebody commented and said, I wish I would have said, this conversation should be directed at the doctors because they don't know anything. And I
Mm-hmm.
said, I thought to myself, whoa, it's not that I don't
Mm-hmm.
disagree with you,
Mm-hmm.
right? I actually agree with you, but hold on a minute.
Mm-hmm.
Again, that box, this is mine, right?
Mm-hmm. Yep.
Right?
I
I need
I
to
do
make
not
the
disagree.
decision,
Yeah.
right?
Yeah.
The
I do not
information that I
disagree.
have.
Yeah. That the historical medical model, which again is rooted in whiteness, if
Yep.
we own that's a whole
Yep.
different
Yep.
rabbit hole for us to go, right? But that medical model, right, is a dynamic that has this inherent power dynamic
Mm-hmm.
that's there, right? That they know everything, and that you are here to listen to what they say. So they are given this authority, right, in a lot of different ways, versus seeing who they are and kind of who they are in the community, kind of to their patients as a consultant or a collaborator. Right. I don't see myself as an expert on your life. Right. If you were my client, you're an expert on your life. I'm an expert over here. You have hired me to consult and collaborate on whatever your needs are. I'm not here to tell you what to do and what you need to do and when you should do it and that I am just this, right? So there's we call it a God complex, like an ego
Mm-hmm.
complex that we see across the medical profession, right? And that's also where medical racism, right, comes in, right? Because oftentimes what we're seeing or what we have seen in medicine is that they are offering information for you to make behavioral change, but they're not arming you or empowering you with information, right? And again, they can't give you all the information that they have that they've learned in these ways, right? But they don't point you towards resource. They just say like, you need to listen to me, which is actually more disempowering than empowering, right?
I, and it's actually, I actually agree with you. Like,
Mm-hmm.
I want to know what in the hell is a hot flash? Like, I wanted to understand why is this happening to me? In addition, why isn't it happening to somebody else at the same
Mm-hmm.
rate? Like, we're all going to experience it. The
Mm-hmm.
estrogen is going, right? I don't,
Mm-hmm.
it's not up for discussion,
Yeah.
right? It's going to happen, right? And so the notion that you're putting, again, giving somebody else that level of control, right?
Mm-hmm.
Like, doctors hate to see me coming because the appointment is going to be an hour. because
It's
we
gonna be long because I
it's
have questions.
so
I have
many.
questions.
And I'm
Some of
gonna
them,
ask you.
some of them I already sent you in the portal. Some of them I already sent you before the appointment just to, cue
Because
you up. But
I
I
did all this
have
research already.
questions.
Correct.
Yeah.
And
Yeah. I
and
have questions.
and I want you to tell me the who, the what, the when, the why, the how. Right? I would never
Mm-hmm.
insert myself to the point where, I know more than you. That's just like not
Mm-hmm.
possible, right? But I have the right. I'm coming to you as the expert for us to I love that you said collaboration, that we're
Collaboration.
collaborating on how to achieve optimal wellness, whether it's mental wellness,
Mm-hmm.
physical health, wellness, and the like, right? So,
Mm-hmm.
because I think a lot of women, it feels normal that that's happening because it happens in everyday life, especially with
Yes.
Black women.
Yes.
We are not heard. I had a friend say to me today that for the first time, because all the things that we're doing around, because I am presenting Black women like
Mm-hmm.
yourself, other doctors who are like, no, this is no, you do not have to. This is what we're doing. We are here to help you get there, right? And I'm going to
Yep.
learn sometimes too, right? The practitioners I work with now, they're like, sometimes you come here and you like, this is happening. Like, okay,
Mm-hmm.
well, let's check it out. I don't know everything.
Yeah. Yeah.
So I
And there is a
appreciate you
way in which
saying that.
it can be this bind to be in, right? Because we also do see doctors. Sometimes they position themselves as such, and we see them as all knowing. So it can be really frustrating, right, when we talk about something and they don't know,
It
right?
will.
Because we want them to know, right? I came to you so that in the next 30 minutes you need to know what's going on with me, or by the time you get my blood work back, you need to know what's going on with me, right? And I think in general, right, people don't remember, kind of realize that medicine is still a science.
And it's
There are
fluid.
things that are changing all the time. So there are things that we don't know definitively that we're going to need to kind of do some stuff and put some stuff together, right? But that's why I say suffering is impatient. You're coming in because you want an answer to stuff, right? Your suffering is demanding that we figure this out so we can stop the suffering. But that's why this is a collaborative, ongoing. We want you to have ongoing relationships with care providers, not one-off relationship with care providers. Because sometimes I'm not going to know immediately, but I also recognize that oftentimes in medicine, what we see is that we don't want people to be curious about
Well, because
stuff.
there goes the control thing again. Because guess
There goes the control
okay.
piece. Yeah.
And there
Yeah.
goes back to enslavement again, because again, we're control. Okay. So there's that. So all right. So here's that grief thing again to me.
Mm-hmm.
To me, it created grief for me when I realized that maybe these people don't have my best interest at heart. Like it took me a year to figure out that I was in menopause, and found a doctor in Fayetteville. I live in Kennesaw.
Wow.
Wait a minute. And we went to undergrad together, didn't
Mm-hmm.
know her, right? I walked in that door. This Black woman looked me in the face and said, when I went through my 20 minutes of what's happening, and she said, how old are you? And she looked down at her notes and she said, menopause. Just like that.
Just like
And I was heard
that.
at that point. So I felt like I was like, she almost gave me something back right in that moment by
Yeah.
saying, you gained 50 pounds in a year? That's not
Something
even
is.
logical. That's not even like, she's like, what? That's
Yeah.
insane.
Something is
Something
happening. Something
is
is
happening.
happening to you, right?
Correct.
Yeah. And that's where, right? And I imagine that, in terms of your experiences and many people's experiences, what we call medical gaslighting. You go in and you say, this is what I'm experiencing. And you actually said something, right? When you were saying that the medical doctor is the expert, you don't know more than them. You do know more than them. You don't know more medicine than them, but you know your body.
Right.
You know your body. You know what's going on at night. You know what's going on in the morning. You know what's going on with your mood. Like, you know more than them about you. They know more than you about medicine, and that's where the collaborative piece comes in. So you're both experts in that room. You are both experts in
See,
that
you're
room, and
giving
both
me
need to be treated as
right.
such.
Like you're giving
Mm-hmm.
something back right now, even by saying that. And I really want
Mm-hmm.
everybody to hear that, right?
Mm-hmm.
That you do know more about you than anybody else does.
Anybody
So you
else.
can't give up. You can't, whatever that is that's ailing you or not right. You must finish it. You've
Yeah.
got to take it to the end and find a practitioner that will put you in a position to be well. Full stop.
Yeah.
Right? You
Yes.
cannot give up. You just can't. And I
Mm-hmm.
think that grief, you got me right there. Like that word is like, ugh.
Yeah.
So with that, and because we're not going to keep you much longer, but you know, at the age that we are now, there's a window
Mm-hmm.
that we're in. Our parents are getting older,
Mm-hmm.
right? Some of us have lost our parents,
Mm-hmm.
right? And that is especially, I mean, it's already like a traumatizing experience. But you insert something like a perimenopause menopause, it's almost like a powder keg. I mean, look, my father died 2,444 days ago. Be clear. It feels like it happened 1 second. I got the phone call literally in the middle of this conversation. It feels very right now. I feel the exact same pain that I felt 2,444 days ago. The exact same. And I didn't know I was in perimenopause, right? I didn't, right? I mean, all I knew was I hit menopause, but at that point I was in peri.
You
And
are right.
it was the most devastating thing. Like, it still is. It's devastating. And I have so many people in my network, in my peer group, that are like severely and physically grieving. Like it's been years and they cannot move forward. I mean, I felt like, I mean, it's like, oh God, it's like some days I'm just like, I have to like pinch myself to say, did this really happen?
Did this happen? Yep.
Like
Some
some
days
days,
it's about the remembering, like, oh, wait a minute, right? It can be disorienting. And at any stage in time, grief
but
doesn't
what is
have this
that though? But
like marker of, yeah.
what is that? 2,444 days ago. That's 2,444 days. Why? What is that? Like, what is
That's a
that?
grief.
Like, but at some point, I'm looking for an end.
That's right. So, and that's a different conversation, right? Because what it is grief, and that is how it is, kind of metabolizing, right, in your body psychologically, emotionally, right, spiritually, right, physiologically, right. What you're also naming is that I want this experience to stop. I either want to stop counting, I want to stop grieving this intent, whatever it is that I'm wanting to stop, right? That is something to pay attention to. That's something about maybe now it feels like suffering, or now I have some notion around how long this should last or what it should look like. That tells me that there's some rule under there about what this is supposed to possibly look like, and I want this to end, and that'll take some processing, and it might not ever end. It will move through its different phases and stages, but we also go back and forth through phases and stages, right? Grief is something